Good afternoon, everybody. Thank you so much for joining Resilience Advocates for Ending Violence for When Staying Home Isn't Safe, Domestic Violence and COVID-19. My name is Holly Jasinski, and I am the Resilient Spaces Program Facilitator. Resilient Spaces is an educational and training program designed for businesses and faith communities to help them recognize and respond to domestic violence. So prior to the stay-at-home mandates, I was out in the community providing trainings like this, but now we're online. So thanks so much for joining us. Joining me will be Adrienne Field. She's a domestic and sexual violence advocate at Resilience. Adrienne has more than 12 years of case management experience. 7 of those have been exclusively advocating on behalf of domestic violence survivors. Adrienne has also done extensive work with law enforcement, both in West Michigan and in Northern Indiana, helping to ensure the safety of victims and to hold perpetrators accountable. So what we will cover today, we have 1 hour to talk about a lot. First of all, why have this discussion? Why is it important to talk about COVID-19, stay-at-home mandates, and domestic violence? Then we want to cover a basic overview of domestic violence so we can know what we were talking about and what the issue looked like before COVID-19, so we can talk about what it's looking like now. So then we'll talk about COVID-19 isolation and power and control tactics that we have been seeing among our client population and ones that we've been hearing about nationwide. We want to talk considerations for specific populations. COVID-19 and domestic violence are affecting different communities in different ways, so we want to be able to touch on some of that. And then we want to talk about resources, what Resilience is doing to support survivors during this difficult time, and how you as community members can help. So we'll jump right in. Oh, I should mention, if you have questions, since we are limiting this to 1 hour, please put your questions in the chat box, and Adrienne has graciously volunteered after I asked her very nicely to stay on top of those questions today. If there's anything we don't get to, we'll be sure to follow up with you afterwards. So first of all, why have this discussion? Why is this timely? Why should we be talking about this? Well, domestic violence is widespread. So even before there was a pandemic with COVID-19, we had a global health issue on our hands already with domestic violence. Nearly 1 in 5 women and about 1 in 7 men report having experienced severe physical violence from an intimate partner in their lifetime. About 1 in 5 women and 1 in 12 men have experienced contact sexual violence by an intimate partner. 10% of women, 2% of men report having been stalked by an intimate partner. And we know that domestic violence does not discriminate. It occurs in every community. So anyone can be a victim of domestic violence. It doesn't matter, regardless of race, age, gender, ethnicity, sexual orientation, education, or economic status. Even prior to the stay-at-home mandates, our prosecutor, Ron Franz, our chief prosecutor, called domestic violence Ottawa County's biggest problem. The Sheriff's Office has reported since the stay-at-home mandates a 41% increase in domestic disputes and domestic violence incidents, and this is comparing that to the same period last year. And at Resilience, we've seen a 66% increase in requests for emergency shelter on our 24-hour helpline. So these issues are intersecting, and we're seeing it very close to home. So we should do a brief overview of domestic violence. If you work in this field, some of this will be a review for you, but it's always good to have a refresher. Domestic violence is a pattern of abusive behavior used by one partner to gain power and control over another partner. So some fast facts about domestic violence. Domestic violence is a learned behavior. And this is one of the reasons why it's important for us at Resilience to focus on youth prevention with youth, because kids that grow up in homes where there is violence are much more likely to be in abusive homes as adults. So interrupting that cycle is a big part of what we do. Domestic violence isn't always physical. In fact, most survivors say that emotional abuse is what leaves the lasting scars. So bruises, broken bones, those heal. But that emotional abuse, having somebody put you down, belittle you on a daily basis, make you feel like you're not worthy of love, those are the things that folks really have to work on, that stay with them for years, even after the relationship has ended. Violence is a deliberate choice made by the abuser in order to take control over their partner. So sometimes when we read about domestic violence or hear people talking about it, they might say like, oh, they flew into a blind rage, or that, they've never done this before and they just, they were seeing red and they were out of control. Well, we know that violence is actually a choice that's made by the abuser. Otherwise, we would see this type of behavior in all aspects of that person's life. So there'd be no reason why they wouldn't fly into a blind rage and beat up their boss, their neighbor, a stranger. So specifically, this is violence against the partner. It's a choice. Abuse may occur during a relationship, during a breakup or a separation, or after the relationship has ended. So that's a key point. A lot of times, people that haven't been in abusive relationships or haven't known anybody closely who's been in one think that the solution is just to leave. Why wouldn't they just leave? Why would they stay? But the reality is, ending an abusive relationship doesn't necessarily end the abuse. And leaving is the most dangerous time. That's when most domestic violence homicides happen. So it can be a really dangerous time, even deadly. Substance use and financial strain do not cause abuse, but they can exacerbate the problem. So we see people that use substances that aren't necessarily abusive to their partners, and we see abusive partners who don't necessarily use substances. But we do know when you throw alcohol into the mix in particular, and some other substances, that can make the situation more lethal, more deadly. It reduces those inhibitions, and that's when we see domestic violence can escalate. Financial strain, same type of thing. There are plenty of people that are well off that are abusers. That's one of those myths that abusers don't have. They're not educated, or victims don't know any better and things like that. And victims and perpetrators come from all walks of life. Financial strain can make things more difficult, particularly for the victim, when that person decides, or if they would like to leave. That lack of access to funds makes it challenging. So we really can't talk about domestic violence without talking about the power and control wheel. So at the center of any abusive relationship is power and control. How that plays out is what you see, where you see the differences in different relationships. So the power and control wheel highlights some of the main tactics that are used in an abusive relationship. So using economic abuse, a lot of times that's called financial abuse. In 99% of domestic violence situations, there is financial abuse. So that means limiting access to the person's funds, not allowing them to get a job or keep a job or have access to any money of their own, making all the decisions about how the money is spent. It could mean, and often means for the survivors that we work with, that the abusive partner has ruined their credit. Sometimes they don't even know that until after they've left the relationship and they run a credit check, only to find out that that partner's taken out credit cards in their name and that type of thing. Using coercion and threats, so that could be threats to hurt the person being victimized, or sometimes it's threats that the abuser is going to harm themselves. So threatening, things like, I'll kill myself if you ever leave me, if you ever dare leave me, I'll kill you, I'll take us both out at the same time. And sometimes it's not quite as drastic as the suicide and homicide. Maybe it's, other things that, threats to harm the family, or, threats to make sure that the person won't have access to any funds if they end the relationship, and things like that. So using intimidation, and sometimes we hear from people that have been abused that the abuse becomes so insidious that even a certain look or a glance can send chills running down their spine. Just that fear, knowing what a glance might mean later on, that might mean, oh gosh, I'm in trouble, or I'm going to hear about this later. So using, any type of intimidation. I was on a crisis call one time with a woman whose partner would argue with her with a loaded gun on the table between the two of them. He never raised his voice, but the point was to get across, I'm in control, I have power, and using that as a weapon to intimidate the victimized person. So using emotional abuse, I mentioned already that a lot of times the emotional abuse is what sticks with people more than anything. Emotional abuse can be belittling, name calling, verbal abuse, those types of things. Emotional abuse is tough because usually when people think about domestic violence, they think about punching, hitting, kicking, and those types of things, where the emotional abuse is really what can start making someone feel like, they're losing touch with reality. And we'll talk a little bit about gaslighting as well. Using isolation. Using isolation is particularly important in our conversation about COVID-19 and stay-at-home mandates. Using isolation means limiting who that person can see or talk to, cutting off their relationships with family and friends. And now with COVID-19, typically with isolation, a lot of times abusers will use jealousy as the excuse, but now with stay-at-home mandates, they can increase their argument for not letting their partner access family and friends, see other people. And they may even manipulate that to the point where, where they're saying like, you can't leave the house at all. So things like that. Minimizing, denying, and blaming. So minimizing the abuse, acting like it's no big deal, denying that it ever happened at all, and then blaming the person for being abusive. Things like, if you would just come home on time, you wouldn't make me so mad. Or if you just made sure the kids were quiet while I was sleeping, I wouldn't wake up so pissed off. So, taking out any responsibility for their own behavior and putting it on the other person. Using children. This is a good example of a tactic that can be used long after the relationship has ended. A lot of manipulation comes up with visitation with kids, with fighting over custody and things like that, where sometimes it becomes more of a tool to hurt the other person than it is about actually spending time with the kids. So other ways that using children can come into play is threatening to call Child Protective Services, telling the person they won't, ever be able to see their kids again, lying to the kids about the partner, using the children to relay messages, all of those types of things. Using privilege. Typically with this, I think of traditional gender roles. So if you were to use male gender roles, it would be, I'm the king of the castle, I'm the guy, I get to choose what we do, kind of using those very traditional strict gender roles where women are supposed to be home with the kids, not having a lot of say in how things are running within the household. And that can be flipped around too. So we might see a situation where a woman is abusive towards a male in a relationship, and maybe she's turning that into, you're supposed to take care of me, what kind of man are you? And using that as a tool for manipulating and abuse. And privilege can look other ways too. We'll talk a little bit about this a little bit down the road, but when one member of the couple maybe has a better understanding of English, or English isn't their second language. And so they're using their privilege of being able to communicate to filter the information that comes to the partner. So using that as another way to prevent them from gaining power and control over their own lives. So COVID-19 and domestic violence. So I want to get into some specifics about how these two issues are overlapping and what we're seeing. So I thought this was a great quote. This is Katie Ray Jones. She's the CEO of the National Domestic Violence Hotline, and she was interviewed for the New York Times. We know that anytime an abusive partner may be feeling a loss of power and control, and everybody is feeling a loss of power and control right now, it could greatly impact how victims and survivors are being treated in their homes. So we know already that the tone has been set for an increase in domestic violence, both in frequency and in severity. And fortunately, this topic has gotten a lot of attention. And I think that's really important to note, that this is a good thing that people are talking about this. Of course, it's not a good thing that domestic violence is increasing, but the fact that this is something that people want to know more about. We had more than 60 people register for this webinar. People want to know more. They want to know how to help. They're thinking about what could be happening with their neighbor or someone else that they know, knowing that these lockdowns just to create an environment for very dangerous, sometimes deadly situations for victims. So some specifics with COVID-19 and domestic violence. Most of the tactics and the things that we've been hearing can fall into roughly these 6 categories. So one is lack of respite. There just is no break. You are with your abusive partner day in and day out. So no one's going to work, no one's going to school. There's that. No opportunity to even take a breather. There's that increased isolation that we talked about. So not only is it that your abusive partner may be limiting how you're moving around the community, now it's a rule that you're not supposed to be interacting. You're not supposed to be going anywhere. You can't go to church or school, or even visit family or friends. So lack of privacy. This I usually think of as like kind of micromanaging, where the abuser is constantly following every single move of the person being victimized, of the survivor. So, when 2 people are in close quarters, then that abusive partner has even more access to what is he or she looking up online, maybe reading texts, just, not allowing any privacy whatsoever. Limiting access to lifelines. So lifelines, that could be your place of employment. It could be a faith community. It could even be going to the hair salon and having somebody to talk to. Those lifelines that Resilient Spaces works a lot to train, so they're equipped to help people when they disclose, because we know when people feel safe, they're going to start talking about what's happening to them at home. But with stay-at-home mandates, there's limited access to those types of lifelines. And then financial abuse. We talked a little bit about what that means already, but we are likely going to see an increase in that as people are losing their jobs, filing for unemployment, getting laid off, and things like that. A stricter control around finances within the household by the abusive partner. And then finally, gaslighting. The term gaslighting comes from a 1930s movie starring Ingrid Bergman, where her partner tried to convince her that she was losing her mind. And you can see how that becomes a big part of domestic violence relationships. So trying to convince the person that they're going crazy, denying things that were said, basically, sometimes I call it flipping the script. So just trying to turn your world upside down so you begin to question yourself and get to the point where the connection between reality and what the abuser wants you to think is reality gets very blurred. So a domestic violence survivor anonymously wrote an article that Huffington Post put online called, "I'm quarantined with my abuser. Here's what I want you to know." Very brave for this person to do this. For many of us, the toxic spouse leaving for work provided needed relief from the barrage of intimidation, verbal abuse, and battery. Or excuse me, verbal battery and abuse. Now many of these significant others are either working from home or unemployed. So that lack of respite that we mentioned. And then I wanted to make sure I highlighted the fact that it's not just people that are currently in abusive relationships that are experiencing a really challenging time. It's people that are survivors that maybe have been out of a relationship that are still experiencing those kind of residual effects. So PTSD, post-traumatic stress disorder, is very common among domestic violence survivors. And a survivor that is closely connected with resilience, I asked her to put in her own words what this was like for her, and this is what she sent me via email. "Even though I'm out of the abusive marriage, the stay-at-home mandates really triggered me. Everything happened so fast. Resilience had to shut its doors, school was announced closed, and then churches couldn't meet. Everything I built my new life on after getting out of the abuse, the places that were my safe places to go, the family and the friends I gained, I was told I could no longer go or see. I immediately felt the isolation that I had not felt since leaving the abuse, and that feeling again of the isolation triggered flashbacks of the abuse. It was as though I was right back there again. I was not okay. I'm thankful I have God and the tools that resilience gave me and taught me so I could ground myself and I can use them during this time." So I think that's an important, point to make. And, it's worth mentioning too that resilience continues to provide ongoing therapy and advocacy remotely. We immediately switched to being able to do that over the phone and via Zoom meetings and things like that to keep that support there. But you can see how someone who is out of an abusive relationship, how these types of mandates feel just like the same type of power and control tactics used by an abuser. So it can trigger those same feelings once again. So I mentioned lifelines, lifelines being things like work, school, faith communities, clubs, sports, and hair salons. And these are areas that where survivors interact with other places, with other people, make those connections. And these are where other relationships can form that maybe are trusting, where a survivor might disclose that they're in a difficult situation and find someone that might be able to support them in making a next step. So I really like this quote. This is Carolyn Camp-Schulte of Jeffrey Richards Salon. Jeffrey Richards Salon was one of the first salons we trained in Grand Rapids about how to recognize and respond to domestic violence when someone discloses it to a salon professional. And it's shown that it's so common for survivors to disclose domestic violence to salon professionals that now 14 states have introduced legislation mandating that salon professionals be trained in domestic violence, because they really have the opportunity to save lives. But Caroline says, "I have a bond with my clients. They trust me and they are completely comfortable being vulnerable in my chair." So it becomes this relationship, particularly if you're prohibited from spending too much time with family or friends. That's someone you can confide in, and so you're trusting them with a lot more than your hair. So Gaslighting. I wanted to talk about gaslighting and what that can look like in light of COVID-19. Some things that would be common or that are common are making fun of the person for following the precautions that have been laid out, mocking them for having legitimate fears. I think, everyone, regardless of their situation, has legitimate fears around the situation. There's a lot of unknowns. Life has changed very drastically, very quickly. And that's something that we need to talk about. So mocking a person for having legitimate fears or for following the precautions that are out there, maybe wearing gloves, wearing a mask, just minimizing those types of fears is part of gaslighting. That's stupid, you're paranoid, and then denying is always a big part of gaslighting. I never said that, or I was just kidding. That's a big manipulator, tool of manipulation there, as I was kidding. I was just kidding, you can't take a joke, things like that. And then withholding information about the virus or giving them false or contradictory information to confuse them, refusing to listen to them or to understand. So I think that is particularly concerning if the abusive partner is the one that is doing most of the reading and learning about, is more in touch with the news, which is very common if the partner who's being victimized has, if English is a second language. So they're relying on their abusive partner for information. And so the abuser is in that very powerful position to manipulate that and contort reality if that serves them. Considerations for specific populations. So I mentioned already about communities where there are relationships where someone might have English as a second language might be the issue, and they're relying on their abuser for information in that regard. But a lot of information came out over the weekend about communities of color and numbers that are coming out in terms of COVID-19. So this was in the New York Times just yesterday. Communities of color are disproportionately impacted by COVID-19 in terms of infection rates and deaths. The disparity is the result of intersecting threats. African Americans disproportionately belong to the part of the essential workforce without insurance, and working from home is often not an option. That means more exposure to the virus, both in transit and in the workplace, and no way to access affordable health care. For many, the line from day-to-day living to COVID-19 patient is alarmingly short. And I wanted this statement to have its own slide in very, very, very big font. Help-seeking behavior is linked to culture and history. So it's really important that when we're thinking about people, whether it's COVID-19 or domestic violence or both, that the way that they reach out for help and who they trust to provide that help is going to look very different. So I was raised in a middle-class suburb of Flint, Michigan in the late 70s and early 80s. If I needed to go to the doctor, my white English-speaking mom could take me there, and the people working there could understand what she was asking for, and they believed her. And on our way out, we paid the bill easily. It wasn't really that far of a stretch to think that police officers really would rescue your kitten out of a tree. But that's not most people's experience growing up. So it's really common for communities of color, LGBTQ communities to not have a trusting relationship with the systems that are designed to help. So it's not surprising that calling the police or seeking traditional forms of healthcare are not always going to be common. So, and you think with LGBTQ folks in particular, not being taken seriously, a lot of people still don't believe that domestic violence can happen in LGBTQ relationships, when in fact it happens at the same rates as hetero relationships, if not even higher in some cases. And then just the fact that, you know, going in for health treatment could mean, you know, being misgendered for a trans survivor, or discriminated against, you know, so there's a lot of different things. And you think with domestic violence and COVID in particular, if you're not out to your family and you're in an abusive situation, you know, your access to what may be your family, which is, you know, tends to be friends or, you know, other community members, may be severely limited. So I think that's important to think about when, you know, it's not as easy as, you know, why don't you call the police, or why don't you get a personal protection order, or, you know, why didn't you get a COVID-19 test when you thought you were having symptoms? It's not that easy. It's a lot more challenging than a lot of people take for granted. So I want to talk about how resilience is supporting survivors during these stay-at-home mandates. And this is where I'm going to have Adrienne pop in. Adrienne, are you there?
I am.
Yay. Okay. Well, I'm going to let you take it away here.
All right. There we go. Hi, everybody. This is Adrienne Field, domestic violence, as Holly introduced me, domestic violence and sexual assault advocate. All right, so some of the ways that our advocates are assisting people who are calling the helpline or like in need of services right now. The biggest one is our personal protection orders. I think a lot of people are of the belief that the courts have shut down and that PPOs are something that can't necessarily be assisted with, but we're working with people either by providing them copies of petitions if they are in need of it, or working through email, phone. We can still problem solve ways to help people complete these petitions and get them like set up with the courts. That's a huge one. We are also working with people through figuring out customized safety plans. Every person's situation is different, how they're going to handle either trying to exit an abusive relationship or just trying to survive being quarantined at home with their abuser. We're just working with people over the phone or email and providing virtual like assistance with people. So we are able to meet via webcams and talk with people, so there's still some like personal interaction going on. We are also offering a series of virtual support groups as well. So information about those can be found on our Facebook and Instagram. But this is an opportunity for people to either join through webcam or just phone if they don't want to show their faces. There's still the option to join these groups anonymously and still participate as well. So that's a really great new thing that we've started working on. And yeah, we're just continuing to provide advocacy via phone. We're continuing to take on new people as they need our help, providing therapy. Our therapy is currently open as well. And we are always answering our 24-hour helpline and email. We did recently change the address that our crisis email goes to so that it appears as a more discreet, it doesn't necessarily say crisis help at Gmail. And so it's not as obvious if somebody's email were to be gone through by their abuser, but we can communicate with people via that way. So yeah, lots of stuff.
Thank you so much. And I have that email address a little bit further on in the slides. I do want to add that I forgot to add to your slide, Adrienne, that our sexual assault nurse examiner program continues to operate 24 hours a day. So we always have a nurse on call as well as a sexual assault advocate. And so we can continue to provide those sexual assault exams and collect the forensic evidence, otherwise known as a rape kit.
Thanks, Holly.
Yeah. So moving on, how you can help survivors. That's something that we wanted to make sure that we touched on. There's actually quite a bit that you can do. I know a lot right now feels really helpless with COVID-19 and just knowing that there are a lot of people out there that are suffering that need our help. So we wanted to give you some specific things that, that you can take back to your families and your communities. So first of all, add to your contacts right now. If you don't already have it in there, please put in your phone Resilience, our 24-hour helpline at Resilience, 1-800-848-5991. And we also have a Spanish helpline as well, where we have we have bilingual advocates on call 24 hours a day. And that new email address that Adrian mentioned, we wanted to make it look as discreet as possible. So that's just ginnyp411@gmail.com. And you know, a couple ideas here. If you wanted to put this in your phone under a fake name, and then if you needed to share it with somebody that you were worried, you know, might be in danger, then now she's, you know, or he's got the number for, you know, John Doe or Jane Doe, or, you know, whatever the case may be. Or I've seen suggestions like, you know, babysitter or childcare contact, or, you know, things like that to make it more discreet. So that's, you know, entirely up to you if you'd like to do something like that. I also wanted to talk about a campaign that we just started. So I talked about the increase in demand for shelter. Our shelter has been full since before the pandemic. So we've been sheltering 9 families, and there's, you know, no one's leaving because there's no safe place to go. Yet we continue to get more calls for people that are fleeing domestic violence. And so we, you know, we definitely need to be able to accommodate those needs for shelter. So what we've done is looked into alternative ways to shelter people in the community. Our preference would be to, you know, have a huge shelter that where we could support anyone that needs it. But right now we're having to find alternative ways to be able to do that. $76 is the cost of one night of safe shelter for one person. Most of our clients are under the age of 30 and have 2 children. So, you know, just kind of thinking about that in terms of math, you know, when people are leaving domestic violence situations, they are usually bringing their kids with them. And $532 covers the cost of 1 week of safe shelter. So you can find out more at resiliencemi.org, Safe Nights. Other things you can do, this is more specific to if you're concerned about somebody in particular. So reach out and ask if they're okay. And the worst thing that could possibly happen is, you know, you find out that, you know, that, I guess what I'm what I'm trying to get at is people are often afraid to reach out because they don't want to be wrong. And if being wrong is the only thing preventing you from reaching out, that's not a good reason, because you really could be helping somebody that might need to hear from you. And sometimes that's just a matter of letting somebody know, listen, I'm concerned about you, or are you doing okay? Things like that. If someone does disclose domestic violence to you, be sure to listen. Give them time, let them tell their story, and believe them. You know, believe that they're telling you the truth. Support them, provide them resources, provide our 800 number, provide that email address, or provide other support that they may need. And then empower them. So domestic violence survivors have had power and control taken away from them by their abuser. So the last thing they need is for people in a position to help to tell them what to do, because that's, again, taking their power and control away. So what we really want is for survivors to be able to be resilient, to you know, find their own strength and power within, and make decisions for themselves. And then plant the seed. I think this is an important takeaway, that you may never see how much you help somebody. And it may be that, you reach out to help somebody, or you say, hey, I'm concerned about your safety, or, it's not okay for anyone to treat you that way, or just simply, I believe you. And that could be all it takes. That could just be planting the seed. A lot of times people that want to support survivors, whether it's family or friends, they get really frustrated if the survivor's not able to end a relationship right away. And I think it's important as support people that we remember that it takes several times typically for someone to be able to leave an abusive relationship. And that's not because the victim just doesn't get it. It's because, the stars literally need to be aligned practically for the person to be able to leave. They have to have access to finances. There has to be a path out, and there has to be a way to do that discreetly. And so they're not putting, themselves in even greater danger. So if you plant this seed, if you provide the number, and the person doesn't call, or the person doesn't follow through right away, or they don't do what you were hoping they would do after talking to you, just know that you planted the seed. Sometimes it may be that you said one thing to somebody, I believe you, you're better, you're worth more than that. No one should treat you the way that person's treating you. It might be 10 years later that the person remembers that you said that. So a lot more information here. So just spread the word. Resilience is here. We're still providing confidential services free of charge. We're here around the clock. We've got a trained advocate on the other end of the phone 24 hours a day. Share articles, share our posts on your social media pages. It doesn't seem like a lot, but just getting the word out about domestic violence and breaking that silence, that's an important way to be a strong advocate. If you're an employer, if you offer an employee assistance program, make sure your staff know that it's still available, even if your business is temporarily closed. And then for faith leaders and members of faith communities, try to reach out individually to all members of your congregation to check in, not just those who you perceive to be vulnerable. And there are some good reasons for that. Domestic violence survivors often work very hard to create an appearance that everything is fine. And a lot of times that has to do with their abusers' threats and demands. Also keep in mind that abusers are often very well liked, and their public persona may be very charming and charismatic. So a lot of times abuse is happening in the relationships where you least expect it. So don't be surprised about that. And then to learn more, you can always call our 24-hour helpline. And we do have additional trainings and consultations available via Zoom during the stay-at-home mandates. And then eventually we'll be back out in the community face-to-face. So I want to check in and see, we've got a little bit of time, what questions may have come through the chat box that we might want to talk about. Adrian, is there anything that you want to address?
No, I think that we covered it.
Okay. All right, so if there are other questions that we didn't get to, feel free to jot down my email address or give a call to our 24-hour helpline. Even if you're, not calling because you're a survivor or helping a survivor, that's a good way to link up to other services. So just even if you have a question, that just know that someone's on the other end of the line that should be able to help you. We are hoping to get our slides available to you. If you want to have access to those, please email us or email me. And if nothing else, I'm hoping we can have slides and the recording available on our website soon enough. So Thank you so much. If there are any remaining questions, we will get back to you individually. Thanks, everyone. I appreciate you joining us.